Good morning, students. Today's class is on vitamin B9. Is also known as an folic acid. In Latin word, folic acid, folia means leaf here, which is mostly abundantly found in greeny leafy vegetables. Classification of vitamins. Vitamins are classified in two types, water soluble and fat soluble. Today's class is on B complex vitamins of hematopoietic. First vitamin is folic acid and next vitamin B12. We'll be discussing next class. Here the folic acid is also mainly plays a vital role in one carbon metabolism, which is mainly involved in the synthesis of amino acid synthesis and purine synthesis and thymidine synthesis. Coming to the chemistry of folic acid or structure of folic acid. Folic acid mainly consisting of three components, pyridine ring, para-amino benzoic acid and glutamic acid. Here, folic acid is also consisting of one glutamic acid residue. Hence, it is known as an triglutamic acid or folic acid. Folic acid mainly consisting of three components, pyridine ring, para-amino benzoic acid and glutamic acid. Here, the folic acid consisting of another glutamic acid residue. Hence, it is known as an triglutamic acid or folic acid. The active form of folic acid is tetrahydrofolate. It can be synthesized in presence of enzyme dihydrofolate reductase. Here, the reducing equivalents, mainly NADPH and 2 moles of hydrogen, which are mainly present at 5, 6, 7, 8 carbon atoms. Here, the folic acid, which is mainly reduced in presence of folate reductase and formation of 7,8 dihydrofolate acid. In also here, mainly again reduction here. So finally lead to the formation of 5,6,7,8 dihydrofolic acid, tetrahydrofolic acid. It can be synthesized in presence of enzyme dihydrofolate reductase. Folic acid, the active form of folic acid is tetrahydrofolic acid. It can be synthesized in presence of enzyme dihydrofolate reductase. The reducing equivalents, mainly 2 moles of NADPH, and also the hydrogen atoms are mainly present at 5, 6, 7, 8 carbon atoms, and formation of finally 5, 6, 7, 8 tetrahydrofolic acid. Absorption and transport and storage. Folate absorption in diet. It is mainly available in the form of polyglutamate form of folate, which mainly enters into the intestinal mucosa as in the form of monoglutamate. Here in presence of enzyme folate conjugates. So what does it do here? It is mainly 3 to 7 residues which are mainly degraded in the form of monoglutamate. So which absorption at low pH around 5 mainly enters into the blood circulation. In the blood circulation, here the monoglutamate form of mainly present in intestinal mucosa, which mainly enters into the blood circulation in the form of 5-methyl tetrahydrofolate in circulate and loosely bound to the albumin on high affinity of folate binding protein. In the diet, the folate is in the form of polyglutamate form, which enters into the intestinal mucosa. In presence of folate conjugase enzyme, it is degraded in the 3 to 7 residues in the form of monoglutamate. It is mainly absorbed at low pH. So, finally enters into the blood circulation in the form of 5-methyl tetrahydrofolate. In circulation, it is loosely bound to the albumin and high affinity of folate binding protein. It is readily absorbed in the jejunum and ileum of the small intestine. It is mainly stored in the liver and excretion through the feces and urine here. Coming to the synthesis of folic acid, mainly biochemical functions. The biochemical functions, the folic acid, tetrahydrofolate, here coenzyme of folic acid, mainly involved in one carbon metabolism. It is mainly used in the synthesis of amino acid synthesis, purine synthesis, and thymidine synthesis. Here, the one carbon units, or either it may be donor or acceptor of one carbon units, are mainly involving in the reactions of amino acid synthesis, purine synthesis, and thymidine synthesis here. Here, the main functions, it mainly involve in the synthesis of DNA and RNA and pyrimidine synthesis and purine synthesis here. Here N5 methyl tetrahydride folate is one of the initiator for synthesis of protein synthesis in the protein synthesis. Here N5, N10 methyl tetrahydride folate. The one carbon units are mainly present in the form of red rings, which are attached to the N5 and N10, or in the form of blue rings of tetrahydrofolic acid. The one carbon units are attached either to the fifth carbon or to the 10th carbon of both 5 and 10 of nitrogen atoms of tetrahydrofolic acid. The methyl group of N5 methyl tetrahydride folate, which is also used for the synthesis of actomethionine, mainly responsible in transmethylation reactions. Here the one carbon compounds are mainly attached to the 10th carbon or the 5th carbon of both of nitrogen atoms of tetrahydrofolic acid. The methyl group of N5 methyl tetrahydrofolate is used for the synthesis of actomethionine, mainly involving transmethylation reactions. These are one carbon groups and these are the R groups here. The one carbons are methyl group, methylene group, methanol group, formyl group, formimino group, hydroxymethyl group, and these are mainly R groups here. All of these one carbon groups are which are mainly carried by the folic acid. And RDA, normal RDA of folic acid is 200 micrograms per day, but in pregnancy 300 micrograms of folic acid is required. These are the good sources or moderate sources for folic acid is mostly available in the greeny leafy vegetables. And main function in one carbon metabolism. It mainly participates in one carbon metabolism involved in the synthesis of amino acids, purine and pyrimidine synthesis. Here the sources are mainly for one carbon of glycine, serine and tryptophan here. The one carbon groups are formate groups and carrier of one carbon or N-time formal tetrahydride folate, and the product formed in purine of purine and the formal methionine, histidine, form amino group, and carrier of one carbon is N5N10 methynyl tetrahydrofolate, and the product form is purine at C8 carbon. In serine, the one carbon group is methylene group and the carrier is N5N10 methylene tetrahydrofolate, and the product form is serine here, and also methyl, and the carrier of one carbon is N5-methyl tetrahydrofolate, and also product form is here homocysteine. These are the mainly sources of one carbon: serine, glycine, histidine, and tryptophan. These plays a vital role in one carbon metabolism. And also synthesis, mainly needed for the synthesis of DNA and normal maturation of RBC and WBC, and synthesis of purine and pyrimidine. And also when there is a deficiency of folate, which mainly impair in the synthesis of DNA and RNA, this mainly reduce in the cell division, which clinically manifested as anemia and dermatological lesions and poor growth. Here folic acid mainly involved in the production of RBC. Folate or folic acid is mainly involved in the synthesis of DNA and RNA, which impair the synthesis of folic acid, reduction of cell division here, and clinically manifested as anemia and dermatological lesions here. Mainly the folic acid deficiency, the causes of folic acid deficiency in pregnancy, where the requirement is increased here. These are the main increased requirement in hemodialysis condition and prematurity condition and lactation condition, where the requirement of folic acid is more here, and hemolytic anemia and requirement of folic acid becomes of more here. And risk factors. And also these are the intestinal diseases like in tropical scurry, celiac diseases and gastric diseases like atopic gastritis, where the defective absorption here, which mainly lead to the malabsorption here. When the drugs like in alcohol and para-amino-salicylic acid and gastric acid secretions or suppressants will mainly inhibit the intestinal enzymes. So the folate absorption is mainly low here, and genetic hereditary folate malabsorption. Dietary deficiency, absence of vegetables in food for prolonged periods here, and folate trapped here. When there is only one way for regeneration of free tetrahydrate folic acid in presence of homocysteine methyltransferase with the help of vitamin B12. Here, methyl tetrahydrofolic acid must be converted into the tetrahydrate folic acid. It is mostly trapped as in tetrahydrofolic acid. It is free and liberated in the circulation in presence of homocysteine methyltransferase with the help of vitamin B12. Here the homocysteine is converted into the methionine here when there is a deficiency of vitamin B12. So here methyl tetrahydrofolic acid is blocked to its conversion of tetrahydrofolic acid when the deficiency of macrocytic anemia and neuropathies. There is only one way for generation of free tetrahydrofolic acid in presence of enzyme homocysteine methyltransferase with the help of vitamin B12. When there is B12 deficiency, the reaction doesn't occur here. So the methyl tetrahydrofolic acid can be converted into the tetrahydrofolic acid when there is a deficiency of vitamin B12. This is important in methyl transferase reactions. Here homocysteine is also converted into the methionine. When there is a deficiency of vitamin B12 and also the reaction is blocking here. Methyl tetrahydrofolic acid can be converted to tetrahydrofolic acid. And mainly sign and symptoms here in pregnant women and also the deficiency mainly lead to the birth defects and spontaneous abortions here. In elderly patient, those who having low levels of circulating of folate, increased risk of folate deficiency manifestations, mainly reduced of DNA synthesis. Here, the folic acid coenzyme is tetrahydrofolate, mainly involved in one carbon metabolism. It is mainly involved in the synthesis of amino acid synthesis, purine and pyrimidine synthesis. So first of all, when there is reduced DNA synthesis in the folate deficiency, here the tetrahydrofolate is also reduced here. So the thymidylate synthesis is also inhibited here. DUMP means deoxyuridine monophosphate is not converted into deoxythymidine monophosphate in presence of thymidine synthase. Here the DNA synthesis is totally reduced here. So the DTP is not available for DNA synthesis. Thus the cell division is mainly arrested here. Homocysteine is converted into methionine in presence of vitamin B12. Here the dietary folates which is mainly present in intestinal cell, is converted into methyl tetrahydrofolate. In presence of vitamin B12, it is converted into tetrahydrofolate. In presence of dihydrofolate reductase, is converted into dihydrofolic acid. So here the tetrahydrate folate is converted into mainly in presence of thymidine synthase enzyme. DOMP is not converted into DTMP, deoxythymidine monophosphate. Finally, DTP is not available. Deoxythymidine monophosphate is not available for DNA synthesis. Thus, cell division is arrested. Macrocytic anemia with hypersegmented neutrophils here, mainly asynchrony or dissociation here. So between the maturity of the nucleus and the cytoplasm here, the cytoplasm shows of immature nucleus and eosinophilic cytoplasm in the bone marrow cells. And also reticulocytosis is also seen here. Abnormal RBC, mainly destroyed in the spleen here. Hemolysis, reduction of lifespan and RBC. And also when there is a increased destruction of RBC, mainly results in anemia. First, there is an asynchrony or a dissociation between the maturity of the nucleus and the cytoplasm. So the cytoplasm shows of immature looking nucleus and the mature eosinophilic cytoplasm in the bone marrow cells. Finally, what happened here? Abnormal RBC and finally destroyed in the spleen here. Hemolysis, reduction of lifespan of RBC. When there is a reduced generation and increase or a destruction of RBC, finally leads to the anemia, macrocytic anemia. Folic acid is mainly involved in the necessary for the RBC production and the neural tube formation. This is the normal amount of RBC, anemic amount of RBC, microcytic anemia with hypersegmentation of neutrophils here. Finally, hemolysis, reduction of RBC, lifespan of RBC, and increase and destruction of RBC finally results in anemia. Homocystinemia. When the plasma of homocysteine levels are above 150 millimoles per liter, the elevated homocysteine level increases the risk of cardiovascular diseases. Homocysteine mainly injury the arterial wall and the fatty substance are accumulated here. So the circulating immune cells known as an monocytes here at the site of injury causing of inflammation. The arterial cells which proliferate and causing the plaque formation and vessel lining here. So the elevated homocysteine levels which mainly seen in cardiovascular diseases. First, the injury of arterial walls, the fatty substances are accumulated, followed by the inflammation, and the arterial cells are mainly proliferated here, and also in effort to heal the lesion, causing the plaque formation in the vessel lining. Histidine load test or FIGLU excretion test. This is the normal in folic acid deficiency. Histidine is normally metabolized as an 4-aminoglutamic acid to form 4-amino group. Here the 4-amino group is also removed. In the tetrahydrate folate in folic acid deficiency, FIGLU is mainly excreted in urine. Generally, histidine. Histidine is normally metabolized as an 4-aminoglutamic acid. Where in folic acid deficiency, the 4-amino group is also removed here. In tetrahydrate folate in the folic acid deficiency. Hence, FIGLU is mainly excreted in urine. This is a normal in normal case in folic acid deficiency. Here, the tetrahydrofolate is mainly form aminoglutamic acid form, which form amino group is also removed here in tetrahydrofolate deficiency. Aminoimidazole and 4-carboxymide amide group. So the addition of carbon group with the help of N10 formal tetrahydrofolate, which is the last step in the purine synthesis. Hence, this reaction is mainly blocked due to the precursor of aminoimidazole and carboxymide at ribose 5-phosphate. So here mainly accumulates and it is excreted here. 5-amino-imidazole 4-carboxymide ribonucleotide in presence of amino-imidazole carboxymide amide transferase transformalize. So here N-formal amino-imidazole and 4-carboxymide ribonucleotide which mainly accumulates and it is excreted here. This is the last step in purine synthesis. So this reaction is mainly blocked due to the precursor of aminoimidazole carboxymide ribonucleotide is mainly accumulated at ribose 5-phosphate. So it is finally accumulated and also excreted. Birth defects. Folic acid deficiency is during the pregnancy may lead to the neural tube defects such as the spina bifida of the fetus and administration of B9 or folic acid mother prevents of birth defects of fetal malformations. 7 weeks of old fetus. Here the birth defects is mainly due to the deficiency of folic acid. By the administration of B9 or folic acid, mother can prevent the birth defects in fetal malformation. Neural tube defects such as spina bifida is mainly seen in the fetus during the folic acid deficiency. Spina bifida. Here, the pregnant woman requires more folic acid. It can be decreases the risk of neural tube defects and spina bifida, cleft palate, and brain damage. These are mainly malformations due to the deficiency of folic acid. So, administration of B9 or folic acid mainly prevents the neural tube birth, neural tube defects and spina bifida and cleft palate and brain damage can mainly be, these can be prevented by administration of B9. Neural tube development. This we already learned in the anatomy classes of neural tube defects. These are the most common. Spina bifida, encephaly, encephaly. Spina bifida with oculata, with meningeocele, with myelomeningeal seal. Here, when there is a B9 deficiency or folic acid deficiency, if we see one of the manifestation in cardiovascular diseases, left anterior descending artery mainly lead to the lag formation and accumulation of fat accumulated. So, which mainly prone to the inflammation, plaque or in arterial wall, blood clot formation, atherosclerosis, finally lead to the atherosclerosis. In chronic alcoholics, one carbon metabolism, when there is a methyl group deficiency, altered DNA methylation, and dysfunction of gene expression mainly lead to the cell death neoplastic transformation, and impaired differentiation. Chronic, chronic alcoholics, one carbon role is mainly methyl group deficiency, altered DNA methylation, and dysfunction of gene expression finally lead to the cell death or neoplastic transformation and impaired differentiation. And effects of drug. One of the example is 5-fluorouracil. It is anti-neoplastic drug. So the substrate of pamidylate synthase is being incorporated in the nucleotide of 5-fluorodeoxyuridylate instead of DUMT. So that normally binds to the covalently with the enzyme to inhibit the DNA synthesis here. The 5-fluorouracil is the one of the anti-neoplastic drug here. So here the substrate is mainly thymidylate synthase, which is mainly incorporated as nucleotide 5-fluorodeoxyuridylate instead of DUMP. When there is abnormally binding or covalent binding to the enzyme and inhibit of DNA synthesis here. Thank you.